All right, so let's say you just got Medicare and you had coverage through your work or through an exchange or maybe through a union, but when you get to do your routine healthcare things, the things that you do yearly that were always covered on your under 65-year-old health coverage, well, you might find out that a lot of those things that were always covered, now they're not covered under original Medicare. Now this is Michael's Medicare, where we talk about all things Medicare, from plans to benefits to enrollment periods, extra help, prescription drug coverage, Medigap, and the whole kit and caboodle that is Medicare. But before we get to it, please don't forget to like and subscribe, because it does help the channel to grow, but also because it'll help keep you up to date on the newest Medicare changes, the newest Medicare options, and the best ways to make more, better informed Medicare decisions. All right, here we go. So let's start off by talking about what is covered under original Medicare, because it does seem sort of counterintuitive about some of the most basic things that are almost universally covered by coverage through a work or an exchange or union coverage or some other under 65-year-old coverage that is not covered under original Medicare, or is only covered by additional Medicare coverage plans like a Medicare Advantage, a Medicare Supplement, or maybe even perhaps a prescription drug plan. So original Medicare is made up of just two OG parts. That is Medicare Part A and Medicare Part B. Medicare Part A covers things pertaining to hospitalization. So that could be things that would require you to be admitted to a hospital. So maybe an overnight stay or some sort of major surgery, things like that that are big are covered under Medicare Part A. Part A, for the most part, for most Medicarecans, that is people who have Medicare here in the United States, doesn't have a cost because it's been contributed through one's payroll while you are working for the minimum of 40 quarters or 10 years, meaning that they take that money out for Medicare Part A of your paycheck every time you get paid for a minimum of 10 years. So monthly, there is no cost, and typically if you are receiving something like Social Security, you will get auto-enrolled in a Medicare Part A when you turn 65 years old or when you first become eligible. Now, Medicare Part B handles the more day-to-day costs on the other hand. Things like doctor's visits and lab work and emergency rooms and specialist visits and medications that are administered in the doctor's office. So when we think about those medications, it could be something like an arthritis shot or a chemotherapy or steroids or those kinds of medications that are in the doctor's office that require a doctor's supervision. But Medicare Part B doesn't cover most other medications that someone would take at home or that you would pick up at the pharmacy. Additionally, Medicare Part B has a monthly cost that can be paid directly or taken out of somebody's Social Security check if they're receiving a Social Security check. And that cost in 2024 is $174.70, and it goes up on a yearly basis based on Medicare beneficiaries' overall usage as a group and what Medicare anticipates the cost to be for that year. Now, although that seems sort of comprehensive, there are a lot more things within the last 60 years or since Medicare Part A and Medicare Part B had been invented that people need coverage for, but just didn't get updated in the law because, well, I mean, it literally takes an act of Congress to get stuff added. And we all know how well that goes. So let's talk about the 5 things that are not covered by original Medicare that were left out. So first things first, and really the biggest and hairiest thing that is not covered, and it definitely should be covered, but it's not, which is prescription medication. Now, earlier I had mentioned that drugs administered in the doctor's office are sometimes covered under Medicare Part B, and that is true, but medications that are prescribed and that you pick up at the pharmacy are usually not. So things like insulin or high blood pressure drugs or low blood pressure drugs. And these types of medications are going to be covered only under a Medicare Part D plan, or sometimes called a PDP if you love acronyms, or a prescription drug plan, which is a private coverage through a health insurance company. And there are quite a few of them, and some of them are actually major companies, which you would know, but then of course there are a bunch of indie ones that you probably don't know and eventually get bought up by other big companies, and you end up with all the same companies either way. I digress. One other important thing to notice about those is that there is an extra monthly cost to them, and the range can be pretty varied from plan to plan. So the cost for the medication, the deductibles, and the monthly premiums all can range depending on which plan someone would choose. Now lastly, to get a Medicare Part D plan, somebody has to have either Medicare Part A or Medicare Part B. So you have to have some sort of original Medicare to be eligible, but you don't have to have both. You can have one or the other, or you can have both. And then finally, if you meet the income requirements, which are actually pretty high, so you can have a pretty high income and still meet those requirements, you might be eligible to get somehow to pay for some or even almost all the cost of prescription drugs through federal programs like the Low Income Subsidy Program, LIS, or Medicaid or Medi-Cal programs here in California. And we'll do some more videos on those things as well. So yeah, the first and the biggest thing not covered under Medicare are prescription medications. Now, considering how much good it does for folks to have teeth that are looked after, it is really asinine that dental benefits don't get covered under original Medicare or just Medicare. This also means that things like dentures, crowns, root canals, and really any of those things that happen on a routine basis to one's teeth are not going to be covered under just original Medicare. Now, of course, there are exceptions to this. So, for example, if your teeth are connected to some other health issue that is covered by Medicare, this would be like, for example, if you had an oral exam or a dental treatment before a heart valve replacement, or bone marrow transplant, or organ or kidney transplant, or tooth extraction for an infection before somebody gets chemotherapy. So those things would still be covered, but that is a very limited selection of benefits where your teeth are actually going to get covered. Mostly they're not. But the good news is it is possible to pick up dental coverage as a standalone service from, again, a major coverage, or many times there is options for dental coverages through a Medicare Advantage plan, or even sometimes a Medicare supplement plans, and sometimes even a stepped up version of a dental, like a PPO versus an HMO, that can be available through those MAPD plans, but unfortunately they are not available through original Medicare. Now, this next one is pretty straightforward, but again, with all the studies talking about how diminished hearing causes a whole plethora of other issues, mentally, emotionally, it's just ridiculous that these are not covered. But that would be things like hearing aids, which are not covered. Now, hearing aids have come a long way from just the horn that you put up to your ear, like that guy in that movie, The Patriot, but their costs have jumped astronomically. And I know Congress passed something that would allow folks to get hearing aids without getting a prescription, which is definitely going to help. And we will, of course, have to see how that plays out in practice. But Medicare actually doesn't cover the cost of hearing aids. Again, this is another situation where a lot of the private Medicare plans, through usually a Medicare Advantage plans, will oftentimes have discounts or set co-pays for hearing aid purchases, as well as benefits for yearly hearing exams and consultations and fittings. The amounts for these benefits and co-pays for hearing aids really will vary wildly from one carrier to another, and even from one plan to another. But for somebody who may be in need of hearing aids, including myself, according to my wife, just kidding, love you, honey, it is a great benefit and often weighs heavily for somebody who thinks that they may need them. Now, the next one is obviously a no-brainer, which is routine physical exams. So you do get a bevy of one-time welcome to Medicare preventative tests and exams that are covered under original Medicare. So that would be things for screenings like the flu or pneumococcal shots, simple vision tests, reviews for the potential risk for depression, and things like that. But it only happens once. You get it one time as a coverage benefit, and then after that, you're free to go. So this is a big surprise, especially for people who have work coverage or some other under 65-year-old coverage, because almost universally, actually, I think universally, the annual physical is covered by under 65-year-old coverage. I mean, things like preventative checks are pretty simple, and they are fast, and they are relatively inexpensive, and it is just crazy that they don't get covered under original Medicare. Again, getting additional coverage through a Medicare supplement or a Medicare Advantage, or even getting coverage through a state program like Medicaid or Medi-Cal, again with Medicare, will usually get the Medicare beneficiary access to a pretty healthy range of yearly checkups, exams, and tests that go a real long way with that ounce of prevention rather than a whole bunch of the cure. Lastly, and definitely not leastly, especially for a lot of folks who have older family members, maybe older parents or older members of their family who are on Medicare, is the fact that Medicare does not cover long-term care. By this, they mean that this is care that is helping a person make it through their daily activities, but doesn't have a goal of helping the person to actually get better. Medicare defines it as a non-skilled personal care, likely help with daily activities like moving, using the restroom, getting out of bed, dressing, etc. Oftentimes, by the time someone realizes that this is a benefit that is needed and is not covered, it can be a pretty big letdown. Undoubtedly, it is expensive, so I see why it may be a contentious benefit to get added to Medicare through the government, but with such a huge cohort of the silver tsunami that is coming that will likely eventually have to use this type of care, it would be a great way to improve Medicare, but unfortunately at the moment it's not covered. Now, of course, there are standalone long-term care policies that folks can get, and also if someone does qualify for something like a Medicaid or a Medi-Cal coverage, there's ways to get the long-term care covered, but of course there are some substantial drawbacks to each of those. Also, some Medicare Advantage plans may have coverage for related services, but one thing is for sure is that it is not covered through original Medicare. All right, so that is 5 things that are definitely not covered, and it's not an exhaustive list, but 5 things that are not covered by original Medicare, and also some of the ways that you can get them covered if you need to. But some of those coverages do take a bit of planning and timing and some money to ensure that you get them when you can and when you're eligible to do so. Now, that is going to be it for today for Michael's Medicare. And if you have any additional questions or you want to get more information about your specific situation, feel free to reach out to us at the info down below, or give us a comment, or give us a call, or check out our other great videos on the socials on Instagram and YouTube. So for Michael's Medicare, I of course am Michael, hoping that you have a great rest of your day, and goodbye.